Now coming to the concept of low cardiac output syndrome. Whenever a child is put on cardiopulmonary bypass, what happens? Here, whenever the child is put on a cardiopulmonary bypass, a CPB related low cardiac output syndrome will happen. This is following cardiopulmonary bypass between 6 to 8 hours. Your cardiac output comes down. Here you can see the low cardiac output. But this usually improves between 12 to 24 hours. So, transiently, your cardiac output comes down between 6 to 12 hours following cardiopulmonary bypass, but body has enough compensatory mechanism and gets back to normal. If this normal doesn't happen and if the cardiac output is maintained on the lower side, then it is called the low cardiac output syndrome. Usually, the cardiac output normalizes within 24 hours. If it doesn't normalizes and still stays on the lower side, it is called the low cardiac output syndrome. And always you should be looking for evolving low cardiac output. Here, the low cardiac output should be suspected when the post-operative course is unexpected. Okay. You should always have a suspicion of low cardiac output syndrome in the post-operative period if thing doesn't go in your way. And always remember, diagnosing and treating the evolving low cardiac output syndrome is slightly better than treating a florid established low cardiac output state, which is very difficult to manage. So, your success depends upon identifying the evolving low cardiac output syndrome at the appropriate time and treating with appropriate intervention. And what happens to your systemic vascular resistance and pulmonary vascular resistance? I said between 6 to 12 hours your cardiac output comes down. Here you can see the systemic vascular resistance also similarly goes up with the time and your pulmonary vascular resistance also goes with that time. So, your cardiac output comes down. So, in between 6 to 12 hours, your SVR goes up, your PVR goes up, your cardiac output comes down, and after 12 to 24 hours, everything normalizes. Your cardiac output goes up, your PVR and SVR gets back to normal. What are the various catch for evolving low cardiac output? How will you diagnose it? The patient might be tachycardic. They might be systemic hyper or hypotension. They might be core hyperpyrexia, but peripheries might be cold, but the center might be warm. Unexpected agitation. This is a very important sign in low cardiac output syndrome. And your filling pressure gets elevated, persistent elevation in your filling pressure. This might be slowly going up, and arrhythmias also might happen. It might be intermittent or persistent arrhythmias.